I'm Mehdi Razavi. I'm an electrophysiologist at Texas Heart Institute and Baylor College of Medicine. A few years ago, I had just finished a procedure, and I was unfortunately I had to go to another hospital. And as I'm driving across, I get a phone call saying that my patient's blood pressure has dropped, and I was concerned about internal bleeding. And I thought to myself at that point, is there something that I could do to figure this out? Impedance to me struck me as being the most obvious thing, because we know in the field of EP we use impedance all the time, and we recognize that, with blood the impedance is much lower. So the thought I had was that probably, the accumulation of blood should probably affect the impedance, and that's kind of how it started, and we validated it, and here we are. It's not necessarily that identifying it is difficult. It's identifying it early on when an intervention can actually improve the patient's outcome. That's what's difficult. Early knowledge about the onset of a bleed is extremely powerful in these cases, because the interventions that we can take during the course of a procedure, there's a number of things that we can do. I won't get into them, but they're well described, and most clinicians are very comfortable with these. But having that knowledge is the key thing, and once you have that knowledge, you can make an intervention and prevent this from progressing.